Well, no, I know it doesn't feel like the top story anymore because the media, transitioned so well over to the war industrial complex, and trying to get everybody ginned up to go to war in another country once again. But whether you know this or not, COVID's still here. We're still around, at least as a story. And now, this was a story that the media snuck in underneath all their war propaganda last week. The CDC is actually withholding information about COVID-19. They just come out and said this. They've admitted this because they said they fear misinterpretation, Rev. Have you seen this?
Yeah.
Yes. Let me give the public some context. The CDC has admitted that they are withholding large portions of COVID-19 data, including on vaccine boosters, from the public because it fears that the information could be misinterpreted. The leading public health agency only published a small sample of the data it has been collecting, despite us being 2 years into the pandemic, a source told the New York Times. Now, Kristen Nordland, a CDC spokesperson, said the reason for the slow release of data is because basically at the end of the day, it's not ready for prime time. Now, what the heck does that mean?
It's on Saturday Night Live?
Yeah, apparently so. When they say that to me, the way I interpret that is, we do not want people to think for themselves and essentially extrapolate what they see in these statistics. And
Right.
They don't want us to see how we've been basically lying to people for the last few years. Or at least obscuring a lot of the truth so we can control people's lives for the last 2 years. That's what it says. That's what it says to me personally. She added that the CDC's priority when gathering any data is to ensure that it's accurate and actionable. But another reason is that the data could be misinterpreted by the public. Among the data that has been collected but not made public is hospitalizations broke down by age, race, and vaccination status over the last year, and information on the effectiveness of booster shots. Now, Rev, why would they want to keep stuff like that from us?
Well, I mean, if I accept the article at face value, they wanted everybody to get booster shots.
Yep.
But the younger adults didn't need booster shots, or at least apparently those between those 18 and, it says that they didn't include full numbers on those between 18 and 49.
Right.
But then the next sentence says younger adults. Well, what does younger adults mean? Are they
Right.
saying the people between 18 and 25 were just fine, but the people from 30 to 49 needed the booster shots, which I don't see why that should be a problem. If anything, since they were operating with limited numbers of vaccines for large parts of the time, seemed like that would be information they really would want to get out, or information that they say they want information to be actionable, then that should have guided their policy to say, okay, if you're 18 to whatever, you don't need the booster.
Right.
You just need those 2 shots and you're good.
Right.
So that the people who needed the boosters more, people in my age group, for example, would make sure to get them and that they would be available. So, yeah, I don't understand. I don't understand the thinking, other than, like we like to say, knowledge is power.
Yep.
And they want to make sure that we recognize that they have the power.
Right. Now, the data did show that booster shots were least likely to benefit younger adults because 2 shots of the Moderna or Pfizer vaccine or 1 dose of Johnson & Johnson already left them well protected. The CDC also just started releasing data on whether COVID is present in wastewater. Even though some states have been providing figures since the beginning of the pandemic, wastewater data can help public officials predict whether there will be an influx of COVID-19 cases. Now,
Wow.
I think it's important to say this, right? I'm just putting it out there. Based on company financial statements, the Alliance has estimated that Pfizer, BioNTech, and Moderna will make pre-tax profits of $34 billion this year.
Yeah.
Which works out to over $1,000 a second and
Wow.
$65,000 a minute, or $95.3 million per day. So I'm just saying, when you see, this is why we report on how many of our elected officials own stock in Pfizer, Moderna, Johnson & Johnson. I believe it was one of the weeks that you were absent, Rev, where I actually went down into which representatives and congressmen and congresswomen and senators own stock and which stocks they own and which companies they own stock in. And so when you start having the policy that all of us have to live by, basically being dictated by people who have a financial incentive to force all of us to take a shot that I believe they're afraid to reveal that a lot of us don't need or didn't need, then we have an issue. We have a real issue in this country when you have basically our public servants captured by Big Pharma. That's what you have. They are captured by Big Pharma. Now, like I always said, and like you said, you know, people in your age group, my parents, my grandmother, my people, and first responders. You know, I have people in my family who are nurses and stuff like that. For those people, I can understand why they would want to take the shot. But the idea that it had to be mandated to all of us, or that in risk of us losing our jobs, losing our livelihoods, losing our access to live, basically. You had restaurants, stores, all kinds of places that would not let you in unless you had proof that you had taken these shots. And our politicians went along with this because dozens of them they own stock in these companies, and these companies have a huge amount of sway on Capitol Hill. And so now the dust is settling. They've moved on to Ukraine. They moved on to something else. They can sort of let stuff like this out.
Now, but here's one more thing before we move on from this. When the president said with regard to gun control, that gun owners are the only big...
State of the Union. We're going to get the State of the Union when we come back from person.
Okay, well, the reason I'm breaking this now is he said in that speech that there is only one group that is immune from suits, from liability, right? The gun lobby, so they need to change the laws. He was either misinformed, ignorant, or lying. Because there is one other industry that is immune from suits. Big Pharma.
Yeah, you're right. That's another issue. These people, there have been people who have called into this show who've been injured by the vaccine and have not been able and will not be able to sue Big Pharma because our politicians gave them immunity.
Not just the COVID vaccine, for all vaccines.
Right. So now it doesn't matter if you've been injured by Gardasil, by the COVID vaccine, whatever. You know, you're basically stuck and out of luck. And so many Americans went along with this because they were afraid.
Yeah. And why were they afraid? Because of the data that they were given and the way it was interpreted to them.
Right. All right, folks, we will be right back after these messages. We're going to talk about the State of the Union. We definitely got to talk about the State of the Union. Please give us a call, 219-885-1371. The number again, 219-885-1371.
Have questions about your health? Well,